Assalamu alaikum. Hello everybody. Today our video is about ruptured Achilles tendon. In this video, we'll talk about characteristics, clinical features, and radiological features of ruptured Achilles tendon. Characteristics. The Achilles tendon is the largest and strongest tendon in the body, formed from the tendinous portions of the gastrocnemius and soleus muscles, covering 15 cm proximal to its insertion at the posterior calcaneus. The watershed zone, approximately 2 to 6 cm proximal to the calcaneus, is the most common site of degeneration and rupture. This is thought to be due to the sparse blood supply in this region that occurs with progressive aging. Rupture occurs most commonly in men between 30 and 50 years old and may be partial or complete. Risk factors include increase in physical activity, corticosteroid injection, and previous rupture. The most common mechanism of injury follows sudden forced plantar flexion with contraction of the gastrocnemius soleus. Patients classically report a sensation of being kicked in the back of the leg, followed by severe pain. There is a spectrum of other Achilles tendon injuries, including peritendinitis, tendinosis, with peritendinitis and tendinosis representing progressive stages of injury. Clinical features. Number 1. Related to the stage of injury. Either peritendinitis, which is localized burning pain tracking along the Achilles tendon following activity. Tendinosis with peritendinitis, which is nodular thickening, may be present. Activity-related pain, swelling, and crepitation along the tendon sheath. Tendinosis, which is the final stage with focal and nodular thickening in the posterior aspect of the tendon. No pain is reported due to the lack of inflammation. Number 2. Rupture, which is usually present with a sudden snapping sensation in the back of the leg, followed by severe pain. Patients usually remain mobile, but are unable to run, climb stairs, or stand on tiptoe due to loss of plantar flexion. A palpable gap may be detected on examination along with other signs. Number 1. Hyperdorsiflexion sign. The patient is lying on the examination table. They can be prone or supine. Knees are bent if prone. Physician passively dorsiflexes both feet maximally and compares the injured to the non-injured side. Positive test shows increased dorsiflexion or laxity on the affected limb. Number 2. Simmons-Thompson test. Squeezing of the cuff while the patient is lying prone with their feet hanging off the end of the bed. Lack of plantar flexion is a positive sign consistent with rupture. This picture shows figure 1a. Squeezing cuff produces plantar flexion of foot when heel cord is intact. Figure 1b. Squeezing cuff produces no motion of foot in injured leg. Radiological features by X-ray, ultrasound, and MRI. X-ray. It is used to rule out other or concurrent pathology. May show soft tissue swelling and destruction of pre-Achilles fat pad, which is called Kager's fat pad. Findings are non-specific as tear of tendon unable to be visualized. Here on the right picture shows normal Kager's fat pad with clearly delineated normal Achilles tendon. On the left picture, this patient has a ruptured Achilles tendon, white arrow. Note the changes in Keger's fat pad, black arrow. Features of Achilles tendon on ultrasound. Normal tendons have a thickness of less than 7 mm and uniform echogenicity. Fusiform swelling with heterogeneous echo texture and focal hypoechogeneity, mucoid degeneration are consistent with tendinosis. This is a longitudinal ultrasound image demonstrating the appearance of a normal Achilles tendon. This picture is a longitudinal ultrasound image showing fusiform swelling of the proximal Achilles tendon in keeping with Achilles tendinopathy. Loss of tendinous continuity denoted by an area of reduced echogenicity suggests rupture. However, the tendon gap is often replaced by hematoma, which may appear echogenic. Confirmation of rupture is best demonstrated on dynamic scanning of the tendon during passive movement. In complete rupture, the proximal portion of the ruptured tendon will not slide on passive plantar flexion. Partial rupture can also be diagnosed using this technique, as part of the tendon may still demonstrate sliding on dynamic assessment despite the apparent loss of tendon continuity. This is a longitudinal ultrasound image demonstrating a complete rupture of the Achilles tendon. There is a gap between the two ends of the ruptured tendon with reduced echogenicity consistent with hematoma. MRI. It is a gold standard imaging modality, rarely if ever necessary in the emergency department. It is used for equivocal physical examination and alternate imaging findings, or for assessing the severity of the tear for possible operative management. Findings: a full thickness tear often shows a tendinous gap filled with edema or blood. Complete rupture shows retraction of tendon ends. This is a T1 weighted sagittal image, reveals a markedly thickened and edematous distal Achilles tendon. Abnormally laxity is noted along the course of the tendon. And this is a T2 weighted sagittal view. Complete rupture of the Achilles tendon is seen approximately 4 cm above the distal insertion. A small tendon gap arrow is readily apparent.